Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about migraines. Someone had posted a question about migraines and just wanting some more background information or my take on migraines, I suppose, for lack of a better way of putting it. And so I'm more than happy to talk about that. So with migraines, to my understanding, there's a lot of mystery surrounding what ultimately drives and causes migraines. In conventional medicine, there's certainly drugs that can be taken to help mitigate symptoms and also to take as a preventative to hopefully prevent migraines from happening in the first place. And some of those medications work just great. Sometimes they don't work so great. Sometimes they have side effects. Sometimes they don't. In the naturopathic world or in the integrative medicine world or what have you, the non-pharmaceutical side of things anyways, not that some of those doctors don't use pharmaceuticals as well, but anyways, what I should say is in terms of non-pharmaceutical options, in terms of treating symptoms or prevention, there are certain agents out there, but they can be really hit and miss. I've had patients in my practice where we put them on a high potency magnesium supplement and their chronic migraines go away. And I've had patients where it hasn't made a difference. Sometimes vitamin B2 or CoQ10, there's some research on all of those nutrients together. Sometimes they can be helpful. What I should have said before saying those words is please don't take anything within this that I say within this video as medical advice. Please consult with your own personal healthcare authority prior to making any changes with your health or pursuing any treatments or whatnot. There are some herbs like one called tansy, I believe is the common name for that one, and it's sometimes used to help with migraines. Is just they can be quite hit and miss. What I find in practice is that by and large, the really successful approach is finding what is the root cause of what's driving the migraine in the first place, and every once in a while, going on or feverfew. Yeah, it's tanacetum. What's the species name? Anyways, not tansy, feverfew, which is tanacetum something. I can't remember the species name now. Sometimes that will work or other things will work, but in my experience, mostly we have to find the root cause in terms of and address it. So in terms of the root causes of migraines that I've seen most commonly in my practice, I've seen a number of cases where it's mold illness. So that's been a big driver for some of my mold illness patients. And once we start treating the mold, especially if we use a nasal spray to help address mold that may have colonized the sinuses, that's been a game changer for a number of my chronic migraine patients. Sometimes food sensitivities and food triggers, we eliminate those and that goes away. It's not always the case, it's not, I'd say maybe that's 15 to 20% of the time. Say mold's probably more like, maybe 20, 30% of the time, maybe 40% of the time in my practice. Sometimes it's related to musculoskeletal related issues. So there's a history of a head trauma or a whiplash injury or something that's ultimately caused damage to the neck, and then doing either prolotherapy or platelet-rich plasma therapy injections or sometimes other treatments. And sometimes it doesn't involve injections. Sometimes the right type of stretching or strengthening exercises will work, although by the time patients come to see me, they've usually done all of those things. And if it had worked, they wouldn't have come to see me. So those things do work in a number of cases, which is why appropriate chiropractic care or acupuncture or physio or osteopathy or massage can sometimes improve or regularly improve or resolve migraines. Just again, when they come to see me, they've already tried all those things, and again, if it had worked, they wouldn't have come to see me. So not every case responds to everything, including the things that I recommend. I wish I could say everybody responds to everything that I recommend, but it's sometimes we have to try a few different things to find what works. I say musculoskeletally, at least in my practice, that would probably be another 20% or so, give or take. Sometimes migraines are related to patients suffering from chronic infections, in my experience. So whether it's persistent borreliosis, also known as chronic Lyme disease, or some other type of chronic bacterial or viral infection that will sometimes cause migraines, that might be 5 to 10% of the migraines that I see in my practice. And then one that I certainly want to mention, because it can be very important, is when there's hormonally or hormone imbalance based migraine. So when patients come in saying, I get a migraine at this time of my cycle every month, or sometimes it's, some patients are unlucky enough to get a migraine around ovulation and premenstrually, or so sometimes there's more than one portion of the cycle where a migraine occurs. Those are when patients tell me that. Of course, I don't want them to have the migraines, but I'm a little bit excited when they tell me that because, in my experience, low-dose immunotherapy, which I've posted many videos about that up to this point, so please check out previous videos about LDI if you're interested in learning more about it. I find that it works very, very commonly for folks who have migraines associated with different phases of their menstrual cycle. It's not a slam dunk for everybody, but I would say in my experience, it probably has at least an 80% success rate, and that's just fantastic. It's a great therapy. It's easy, it's cheap, and oftentimes very well tolerated. So that's been so that's another possible driver of migraines. So those are my immediate thoughts about migraines. So if there are, for the person who asked the question, if you'd like me to embellish or dive in or dig into any element of that or some other element of migraines that I didn't touch on in this video, please let me know. But that's a little snapshot of my experience with migraines. And by golly, if you're suffering from migraines, I really recommend working with someone who can help you troubleshoot them, because they're just, I'm thankful to say I've never had one, but like I've had so many patients with migraines, I really empathize. I understand how awful they really are, and just there are answers out there. So I recommend looking for them or continuing to look for them if you haven't found those answers yet.